Hi, everybody. I've called this meeting today to discuss a possible infectious disease exposure. Could all of you please introduce yourselves?
I'm Sherry.
Hello, Sherry.
Hello, I'm Ricardo.
And I'm Laura.
Great. Thank you guys for coming to this meeting. And it's been reported by the laboratory that there's been an isolated M. tuberculosis complex from a clinical specimen. I got report from the lab on where they thought this might have come from, and this is what they've discovered. I'm going to read you a brief history of what happened. Frank Barnes is a 47-year-old truck driver who was admitted to the medical unit at Desert Regional Health Alliance. He shared a room with Kenneth Lister. He was in the room with Mr. Lister for 1 day and then released to go back to work. After he was discharged is when the lab discovered this isolated M. tuberculosis complex from a clinical specimen. Infectious control personnel reviewed the electronic health records and observed there were skin assessment notes about red lesions. Due to the recent increase in bedbug prevalence in homeless and other transient patients, the hospital is required to identify and report the possibility of an environmental infestation. Desert Regional Health Alliance utilizes the National Notifiable Disease Surveillance System, also known as the NEDSS. Since we utilize this program, we are required to report infectious and some non-infectious diseases to our local health department. For those of you that are not familiar with what the NEDSS is, it's an internet-based system for public health surveillancing data exchange and monitoring the occurrences and spread of diseases, as noted by the Centers for Disease Control and Prevention website, 2015. Once we have reported the information to the local health department, the health department will then notify the CDC. To utilize this program, there are requirements that you have to meet. Our hospital needed to meet these, and other health facilities need to meet these. There's 3 of them. The first one is electronic laboratory reporting that enables labs to report cases to the health department. The second area that we needed to meet was integration of multiple health information database into a single repository. And the last area that we needed to meet was electronic messaging capabilities, enabling states to share information efficiently with the CDC and other health agencies. So Desert Regional Health Alliance has met all these requirements, and the program has been installed, so we will proceed in reporting this incident. So there are steps to report this incident, and the first one is you'll first access the NEDSS homepage. It will then direct you to a page called My Queues. You will click on the documents requiring security assessment, then follow the steps to select the patient. You'll be able to select the incident or the labs that contain the incident and the information, attach it, and then you also add the patient's address and any pertinent demographics about the patient to this document. Finally, you will print it and you will create an investigation. There's some steps in between from the beginning, from accessing the page to actually reporting the incident, and I've downloaded that, and it's an illustration of how to report from beginning to end. I will email each of you a link so you'll see the process and how we're gonna be reporting this. So we'll be doing that. Does anybody have any questions about this incident? or the process that we're going to of reporting this incident?
No, it sounds like the hospital has done a good job in reporting it and all the necessary things that needs to happen at the state and the local level, as well as the national level.
I agree. I look forward to reviewing that link. Honestly, that should be very insightful.
So we're going to discuss 4 topics. I've just discussed the first one. Laura, will you please discuss the second topic for this meeting?
Sure. Thank you, Sandra. What I'm going to discuss today is how does a surveillance system that the NEDSS uses contribute to the safety and decrease the potential spread of infestations and environmental diseases? Well, as I was considering this question, I thought about something I read in the Journal of Public Health and Management and Practice, and that was in 2001. Before the NEDSS, the National Electronic Disease Surveillance System, there was somebody called John Snow. And in 1854, John Snow, during a cholera outbreak, he was able to identify a contaminated pump. Now, he did this through careful investigation, and he plotted the disease, but he was able to find the pump that was contaminated. And in doing so, he saved an entire population from being exposed to cholera and stopped the infestation of cholera. So I consider the NEDSS sort of like many John Snows working together in the field and pinpointing the disease in the outbreak, the environmental infections and risk assessments. But better now that these John Snows have technology. So all these John Snows in the field are connected and able to, at the state, local level, and nationally, able to share data, which will help the community through safety and decrease potential spread of diseases. Now the NEDSS helps in increasing safety and decreasing the spread of infection. According to the CDC 2012 and the Morbidity and Mortality Weekly Report, it does this in several different ways. Now, the first way it does it is it isolates and treats the source patient. This provides safety to the rest of the community as well as to the patient themselves. Now, in this example, as Sandra explained, our source patient was Mr. Frank Barnes, and so we were able to contact the local health departments and able to isolate him and treat him as well. So that was the first thing that NEDSS does. Now, the other thing it does is it actually takes the burden off the hospitals. So the hospital is not having to use their resources to monitor or to outsource, find these patients that could be source patients or track patients that were exposed. This is actually done by the health department. So it takes that burden away from the clinics and hospitals. They already have protocols in place, and this contributes to the safety of the community. The other thing that they're able to do, the NEDSS, is they're able to be timely. So as soon as a communicable disease is identified, they have something in place that automatically goes into the system, and they everything kind of happens quicker. So, like I was saying about the John Snow's connected, it will connect everybody together, find the source patient, and then all of those that were in contact with this patient. So the fact that they were able to be timelier than we could be at the hospital level, it causes fewer exposures and decreases the potential spread of the disease or the infestation. The other area is the contact or treat any persons in the contact patient. So patient, just like in our discussion today with our patient Kenneth Lister, we were able to, because he's a contact patient, we were able to treat him. But not only him, but Mr. Barnes also has other patients that he's been in contact with. And depending on what that disease is and what the contact, I should say the contact risk is, they will, according to that, it will depend on who will be assessed and who will be followed. And so they're able to do that. That's already in place, and that way that decreases the spread of the disease by finding who has been in contact with this source patient. Now, all of this information goes into the database, as explained earlier by Sandra, and it even crosses state lines. So we read in the public health reports March and April 2012 that when TB exposure happened with a transport van, now this happened in one transport van, but it affected patients in DC, 2 counties in Maryland, 3 counties in Virginia. So we have a total of 6 different counties working together, 6 different health departments working together to prevent the spread of this tuberculosis over all of these 6 counties. So this is really a phenomenal thing that the NEDSS is able to do as well. They also are able to follow up with these patients at the local, state, and national level, as Sandra said earlier as well. The national level also, the CDC will also get this information on this patient and able to keep this data as well and continue follow-up. There are actually laws in place to keep patients with infectious diseases isolated until treatment is complete and they're no longer contagious. At the hospital level, we would not be able to do that. We would not be able to have that mandate, but because of the state and local levels, they're able to do that. And with Mr. Frank Barnes, we contacted the health department, and because of the M tuberculosis located in the lab, but it's not only that, but also the lesions he had from the possible bedbugs exposure. So we were able to not only follow him in 2 different places, so infestation and disease process as well. So the health department is working on that right now, which is just incredible with the NEDSS. And we are keeping Mr. Lester's in the hospital, and we are following their protocol and isolated him and able to prevent him from being exposing anybody else and keeping our staff safe as well. Does anybody have any questions on anything discussed with this question in the NEDSS?
Laura, when you mentioned that there's several states, there are actually 46 states that utilize this program. So they'll be able to get this information out and follow through and track and see if anyone else has been exposed.
It's quite a web of prevention. Really, is what it really boils down to, is a web of prevention, and helps the communities communicate with this technology. It's just, I think it's really we just don't know how much it's saved us, I think, from spread of disease and infestation.
Yes, and you wonder what they did before 2001 when it was
initiated.
That's right.
So Ricardo, does anybody have any questions for Laura?
Oh, very good, Laura.
Excellent.
Ricardo, could you please address the 3rd topic for our meeting?
Yes, ma'am. I was in charge of addressing the possibility of any privacy concerns, any privacy issues, and I think it's reasonable to expect that there's going to be patients that question whether we should be looking into their medical history and contacting them again for follow-up visits and things like that could affect their future care. So in doing the research, I came across some interesting articles, and there was an article called "The Top 3 Issues Facing Patient Privacy," and it was written by Rick Kam, and in it he quotes Dr. Deborah Peel as saying that the lack of privacy causes bad health outcomes, and millions of people every year avoid treatment because they know how health data is not private. So I think it's very important that we keep rapport with our patients and let them know where we're coming from and why. Let them know that we are not abusing the information. It will be used in a professional manner, and afterwards it will be disregarded. And so I think it's is very important so we don't lose the patient's or our patient's trust. And the article also goes on to define other sources of discontent as far as patient privacy, and one was legislative gaps, which it didn't really give a lot of detail, so I'll have to do more research in that. But it did discuss also the lack of patient control in regards to their medical records. You know, back in the day, before the electronic medical records, a doctor or a clinic would just fax a patient's medical record to another physician or to another clinic where it was needed. And you knew exactly whose hands it was going into and who was reviewing the chart. Now with the electronic medical record, several facilities can be reviewing it at the same time, and everybody within those facilities. So, you know, it makes it very difficult to manage who is reviewing the charts and for what purpose. You know, and again, it makes it difficult for patients to develop trust in what we're doing and why we're doing it. So I think being transparent is going to be very an important aspect of that, letting them know exactly what we're doing and how their charts are being utilized, giving them more authority to review their entire charts and for accuracy and inaccuracies, letting us know what's not supposed to be in there and things like that. Perhaps things that they would prefer not be shared with other clinics or whatever. But I think in that we also have to let them know that we have certain responsibilities that are mandated by the state and federal governments, so that they know that we are being compliant with those laws, but also being fair to them. I think there was a joint statement put out by the CDC and the EPA, and that's what it was called, the joint statement. But it also calls out to the public to have them become better partners and colleagues with the local agencies to help better address any disease issues that can develop, to keep better track of them. So I think also that's part of being transparent is, you know, having them help us understand what's going on and why, you know. But I think that's getting them involved is very important in helping to develop and maintain their trust. Let me see. There was also another article called Using Personal Health Information and Do We Manage Conflicting Interests? In it, it was written by Sue Wetton, and she discusses the need for patients to realize what we're using their health charts for, and indeed, it through that study that most patients did want the public interest to be acknowledged, but unfortunately there's a lot of room for gray area there, in that to what extent do we go into a patient's private record, you know, to best serve the public interest. So there's a lot of gray area there in what a patient would deem necessary, and it's very individualistic. And I think there's going to be gray areas that are crossed, and I think it's very important that we handle each as a case-by-case situation and address the patients that have concerns, and let them know what we are doing is within the guidelines, and anything that we are doing is for the better of the public and or required by state or federal mandate.
Yes, I think it is important that we let our patients know that we do utilize the NEDSS system, and assure them that it will be handled, their information will be kept private from anyone that doesn't need to know this information. Right. So just because when a patient knows that we are using this program, I don't want them to feel that we are compromising their information. So it's good that we reassure them.
Yes.
Does anybody have any questions for Ricardo?
I just have a comment. I think that there's going to be a big difference also in generations, with a distrust in I think government also, and that kind of falls into healthcare as well. So that distrust, depending on what generation you're speaking to, that's going to make a big difference as well. So I think your idea about transparency is really going to go a long way.
Yes.
I agree.
Thank you.
Sherry, will you please discuss the fourth topic of our meeting?
Sure. My question was discuss how keeping track of the TB and bedbug outbreaks is beneficial, and then, of course, the value of the national surveillance system. So with regards to the TB outbreak benefit, according to the tuberculosis surveillance data training by the U.S. Department of Health and Human Services for CDC, Centers for Disease Control and Prevention in 2009, that actual national surveillance system for TB was initiated in 1953, believe it or not. And then since 1985, all cases of TB have been reported to the CDC using a form called a Report of Verified Case of Tuberculosis, in other words, RVCT. It's a very detailed form. You can see it on this article, and it is, what happens is everybody gets, the patients get given a number, and their name is not used, and the information is filled out on that form, but the form itself is not sent to the federal, at the federal level. What happens, or the CDC, it's just the data and the number. This form is universal pretty much, and so it's done at the state and local levels, and then the information is sent up to the federal level. The form was last revised in 1993, and the goal of the form is to prevent misinformation. So, you know, with everybody using the standardized form, the data that they collect is unified, very detailed. It's compiled to identify needs and trends, and it's reported annually. Now, according to the CDC 2012, on trends in tuberculosis in the United States in 2011, they actually said that progress towards elimination will need to be ongoing to monitor, you know, and prevent the control of TB. The trends in tuberculosis, what they do is monitor racial ethnic groups, those born in U.S. and those that come from out of United States. And that's a great article too. It talks about, it has tables and, you know, the trends of the active cases of TB. Even more interestingly, there is a global World Health Organization that actually monitors the multi-drug resistance TBs, which I didn't even know existed. I don't know if you guys know that, but there, you know, like how you have MRSA. Well, there's multi-drug resistant tuberculosis cases, and according to the World Health Organization, there's a global, it's called Global Supernatural Reference Laboratory Network. It's called SRLN. And they were established actually in 1994. They're 20 years old. In 2014, they're celebrating their 20th anniversary. They are the oldest and the largest data surveillance type of thing system that collects global data on multi-drug resistant active TB cases. In 1994, they were only actually able to collect 16% globally of the multi-drug resistant TB cases in the world. And as of 2014, now it's 95% of the cases are reported to them. So they have all of the cases reported to them. So that, I thought that was very interesting to throw in there, by the way.
That's incredible.
I know, isn't it?
Mm-hmm.
So, you know, the value of the national surveillance system is part of my question. You know, without all of this, these forms and information, you know, how would we know any of this? You know, how would we know what's going on globally? How would we know what's going on in everybody's state and local departments? Before they developed this RVCT form, everybody just kind of did their own thing, and it was hit and miss on what information everybody collected. It was just based on their own, whatever they thought was important. So the information wasn't standardized, and nobody was really getting the information. And you know, it's so important that everybody gets the standardized so that you can monitor racial, ethnic, not only that, but you know, if it's multi-drug resistant, or if you know where it came from, what states are most prevalent, you know, which states are not as prevalent that may have it, and actually maybe where it came from, you know. So I think that this national surveillance data is really good. With regards to the bed bug outbreak, which is part of my question also, according to the U.S. Centers for Disease Control and Prevention, the CDC, along with the Environmental Protection Agency, which is also the EPA, they reported a joint statement on the bed bug control in the United States. And I don't know if you guys realize, and I'm sure everybody's heard it, but you know, bed bugs were kind of unheard of like a few years ago, right? I mean, haven't you guys noticed, like, it's all of a sudden this big, huge thing, bed bugs, and people are going around and finding them in hotel rooms and everything? Well, it's true, because there has been a resurgence, according to their joint statement on the CDC and the Environmental Protection Agency. There has been a resurgence of infestation of bed bugs over the last several years. So the thing is that there were few outbreaks in the previous decades, so people stopped studying it. You know, people stopped collecting data on it. There's been limited pesticides in combat to use against bed bug outbreaks because they really have never, they haven't had to in a while. So the problem with that, though, is that people were just kind of doing their own thing because there wasn't really any pesticides. You know, I mean, they stopped developing them, so people were using their own home remedies. Mm-hmm. And so the misuse of a cockroach pesticide for a bed bug, in addition to public safety risk of using a cockroach pesticide all over the bed, you know, as a safety risk to your kids and everything else, as a public safety problems, the EPA said, hey, you know, their purpose is to protect the safety of humans against these pesticides, while the CDC is still trying to figure out what the heck is going to work to kill it off. So the CDC and the EPA are partnering to research the most effective ways to safely control the bed bugs and prevent the transmission of diseases, of course, because the bed bugs do transmit diseases. So it's nice that both of these agencies are available to do that.
Yeah.
So with that being said on the two TB and bed bug, my last part of the question was the value of the national surveillance system. And, you know, again, as you both, or all three of you have, you know, pretty much touched base on the NEDSS. In 2001, it was an initiative that was focused on the development of healthcare for the timeliness and quality of patient information, like you had said, Laura, between public and private healthcare. And the CDC, in collaboration with the state and local health departments, have developed this NEDSS to collect and interpret data regarding the health of the public and to detect public outbreaks. There's 8 elements to the system, which is pretty detailed. So, but the whole big picture of it is that the reporting is to integrate the health information at the federal level so that information can be collected and issues identified with the goal of increased awareness to the public. So everybody reports up to the federal, and then the federal is able to, say, hey, this is going on over here, and this is going over here, what's the connection? They're able to see the whole big picture instead of everybody just not really knowing what's going on with your neighbors. So that's really nice about the national surveillance system. I mean, in a nutshell.
Mm-hmm.
So the goal of the NEDSS is to have immediate accessibility immediately, because if everybody's reporting it up, they have immediate access because they got the whole data in their system to identify and monitor early outbreaks of infectious disease along with bioterrorism attacks and disease trends. So I think that, I think this is a really, this national electronic disease surveillance system is really good. Now, touching bases on what you had said, Ricardo, that privacy rule, by HIPAA, is very important to keep into consideration, with the making sure that information is not going where it's not supposed to. So it's nice that the RVCT form is locked at the state and local level. They keep it in their building. All they do is send the information to the federal level with a number, so that patient information is just not all over the place. So I think it's great that the RVCT form stays within the CDC TB division of each state and local health department. That's all I have.
Thank you very much. That was very informative. Does anybody have any questions or comments for Sherry?
Sherry, I was just going to mention that I'm glad to know that the TB form is actually, TB is being surveyed globally, because people are traveling more and more. I mean, they travel globetrotting. They're all over the place. So not only bed bugs and TB, but both of them, TB and bed bugs, people are kind of spreading themselves out and spreading and potentially spreading these diseases and these infestations. So it's good to know that they're actually monitoring or surveilling this whole issue. So it's really good. I'm glad to know that. Thank you.
You're welcome.
Sherry, you did mention, this is off topic somewhat, but you mentioned that bed bugs do spread diseases. However, I did read that they don't spread diseases. Just for our own information, I guess we can kind of research that and see.
Actually, there was the head, or there were certain bed bugs that did, and there were certain ones that did not. But a good example of that was the head lice, for example, do not carry diseases, but the body lice do.
Oh,
so there are certain ones that do carry diseases, but not all of them do.
Okay, thank you for clarifying that, Ricardo.
Well, here's the deal. If a bed bug's going to go from the blood of one individual one night at a hotel, and then the next night, here comes another guy, and they're going to bite that same guy, and there's the blood. I mean, if you think about it, I mean, there's a possibility, like mosquitoes, when they bite, it's the same thing. So, I mean, I wouldn't want to take any chances.
I wouldn't either, but I was a little relieved when I did read, because I would think of blood to blood it would, but it was kind of did relieve me to read that they didn't spread. But anyway, I don't want them anyway. So, does anybody have any final comments? One area where I think the hospital, Desert Health Alliance needs to investigate is, even though we are reporting this information to the NEDSS and following up with that, we need to look and see how this patient was paired with. So, I'll follow up with that and see why he wasn't still isolated until all the samples did come back.
Agreed.
Okay.
That's interesting.
Okay. Does anybody have anything else to add to this?
I just kind of want to walk away with a recommendation. Also, is maybe ensure that we form an ethics committee to kind of review not only patient concerns but staff concerns. Because a lot of the times it's the staff who are caring for these patients before we even know that they're infected with such infections such as TB. And so it's down the road that it comes back. The patient could have been infected with TB, so now we have the staff that needs to be evaluated as well. And so I think in the best interest of both staff and patients, kind of reviewing the process and having an ethics committee to sit down and review each case individually would be good.
Yes, and I'll research that protocol and see what is the protocol. If somebody is being tested for TB, shouldn't they be isolated until all results are back? So we'll follow up with that.
And, you know, I'd like to just add on to what you said, Ricardo, about, you know, that when it's found that there is an outbreak and it is affecting staff or anybody for that matter, the privacy rule, you know, the concern for that is that that person's name, maybe a staff member, you know, would only be used for that specific moment of the public safety, but not be able to be utilized again and again and again later on. You know, that would be on a not to need to know basis, and that would violate the privacy rule for HIPAA, you know. So the patient's name information should only be used for that one specific time period or one specific public safety outbreak, but then, you know, somehow it should be known that with electronic data that it's not, we don't have access to use it again, you know, or just, you know, say, you know, later on, oh yeah, you know, it's always there, so we shouldn't access it.
Right.
So that's what's important about that privacy rule. So yeah, I agree, a recommendation. I mean, especially as managers and leaders that we monitor that kind of information, because, you know, curiosity with, you know, that kind of stuff with staff members in units, people just have a tendency to, you know, hopefully nowadays people don't violate HIPAA, but it's something to be careful about when we have public outbreaks, and then when everything dies down, that it's not just available for everybody to continue to access.
Yes. Okay, well, thank you guys. If there's nothing else, or if you have nothing else to add, then we'll adjourn this meeting, and I'll send out that email with the links to notify the NEDSS of an outbreak.
Awesome.
Thank you.
Thank you.
Thank you.
Everyone. Have a good evening. Bye-bye.